Hello, fans. This is another edition of Heady Living on Asset Television. I hope you're doing enjoying our last program. So today we'll be talking about ulcer. I'm your regular host, Blessing Chima, and with me is Dr. David Babalola. We welcome on the program.
Thank you very much for having me.
All right. So, Doctor, can you just probably tell us what ulcer is all about? Because I went to the street the other time to find out what people feel about ulcer, and they said, almost every Nigerian have an ulcer. I laughed. I was like, how truth is that? You're watching me. Do you have an ulcer? So, doctor, tell us much about what we need to know about ulcer. Give us information, details about ulcer.
Okay. Thank you very much for having me. It's a privilege to be back on the show again. And hello to our viewers once again. So, also, I just want to clarify some things. The first thing is that ulcer is actually a spectrum. When I say spectrum, I'll break it down for everyone. Spectrum is a group, is an umbrella that covers a lot of diseases, and it is like from one end to the other. So ulcer is just a very vague term, but when you come to the hospital and then you say you have ulcer, we already know how to interpret it. So, ulcer generally ranges from inflammation of the lining, inflammation of the lining of either the esophagus, either the stomach, or either the small intestine, to a wound being created inside. Also, or to even a tumor, even inside. So it is a range from, it's like a process from inflammation being something being angry. It's like the inner lining of
But sorry, it's usually from the stomach.
it could be no. So when we say ulcer, like I said, so it's generally people just think it's from the stomach because the symptoms look like it's arising from there. But ulcer could be in the lower part of the esophagus, it could be in the stomach, it could even be in the small intestine. That's why we call it peptic ulcer disease. So it is like an umbrella. So it ranges from what is called gastroesophageal reflux disease. Gastroesophageal reflux disease is reflux. I don't know if it has happened to involve maybe anybody watching that you eat and after some time you are having heartburn. That's what people call heartburn. Heartburn is different from the classical ulcer that we hear about. So when sometimes you eat and it's like the food is coming back and then you are feeling peppery sensation, especially if you eat maybe a food that is pepperish, or you even feel you sometimes feel the taste of that thing coming back and it's like it's coming back and people regurgitate it. It's normal in small children because their systems or their organs are not well developed. But in adults, it's not normal. So, it ranges from that even to the actual ulcer, which is like a wound. So, also, I want to just say that ulcer is, in medical terms, is a very wide word. For example, wounds in medicine or in surgery, we call them ulcers also. So people who have all these ulcers and wounds that
And
are
in the
not,
hand,
yes,
in
in
the
the
leg.
hand, yeah, exactly.
Yeah,
So the same way
okay.
you have wounds outside the body is the same way the ulcer looks inside. Now you could have this kind of ulcer in the stomach, that's what we call gastric ulcer. You could have it in the small intestine, which is what we call duodenal ulcer. So, that is one. Then we can also have another one called Zolliger-Ellison syndrome too. So they are all, that one is a severe type. It's just like from one end, it's like a small, beginning from the little reflux that people have till
So
the
the hand
ulcer,
also.
yes, to the ulcer, gastric ulcer, duodenal ulcer, then to that Zolliger-Ellison syndrome. So it's a several, it's like several diseases all grouped, all put, and then we call it, and then people generally just call it peptic ulcer disease.
Okay, the ulcer in the hand, the one on the leg, as it can happen to any part of the body, just like cancer, right?
Yes, exactly. So I just use that to explain that the same way you have a wound, you can have a wound outside the
Yeah.
body. It's the same way ulcer looks. We have a procedure called endoscopy, which is actually the
But
gold
I've
standard.
actually seen some persons having ulcer in the hand.
Yes,
Wound.
exactly. So, but the reason why I just said that was I'm just comparing it. The one inside, it's similar to that. So that one is a different ulcer entirely. It's a different ulcer, different cause, different treatment, different.
Okay, it's not the same treatment.
No,
The one.
it's not the same place. It's not, but I was just trying to say that the word, because so many people when they say ulcer, people just think it is only inside. So ulcer is a very broad word, but you have to be specific. When you say peptic ulcer disease, okay, the person that is listening to you now knows that okay, this person um, is talking about um, the one inside the body compared to the one outside.
Well, how severe is this ulcer? How deadly is this ulcer?
Okay, so well, I'll more of say that ulcer, the symptoms is where the problem is. Yes, so it's terrible on the long run because it could number one affect the quality of life of a person. So a person with ulcer could be as terrible enough to affect one's quality of life in such a way that the foods normally that you other people would eat or you would normally want to eat, you may not be able to eat it. We'll still talk how about how ulcer comes about, and that's when I will also explain the also explain how I also explain the way it can affect the quality of life. But for it could affect one's quality of life. That's one. It could also later on, and that will be years after. It could come down with cancer because repeated inflammation, irritation of the inner lining could predispose to what we call gastritis, and then from gastritis it could now cause cancer. But that will be years after. But to affect the quality of life, it could also cause bleeding. Um, for people who are watching, if you've ever seen people who bleed, who vomit blood, or who defecate blood, ulcer is the commonest cause in this our
So I
environment.
want to ask you, this ulcer, could it be curable? Is it curable?
Yes. Well, yes, it's curable. It's curable in the sense that let me just still go back to the ulcer that we have outside. So I can have a wound.
Because I actually have some persons that says ulcer is not curable, and they've been having it for some
No.
quite some years now.
Yes.
They've been treating
Thank
and
you. So number one is if you don't treat it well, you will think now. Okay, let me first go back to the ulcer outside. When a person has an ulcer outside, or maybe has a wound, if you treat that wound and then it begins to heal and then it heals, but the same thing that caused it, maybe it was a fight, maybe something pricked the person, maybe the acid or something happened to that place and caused that ulcer. If the same thing still happens again, that wound will come back. So it
yes,
will be
we
as if,
occur.
but yeah, to reoccur. So that's the same thing with ulcer too. If it is treated well, there's something we call triple base therapy for ulcer. That's the gold standard. Yes. So it's not just if you go to the average person, and if you go to the average chemist, they just give you maybe one or two medication, but then there's what we call triple base. In fact, we even have quadruple base therapy. That's the compact one. If one takes it and then takes it for adequately, if one takes it adequately, and then you also take it to some other modification, it will go. But if you still do the same thing that you were doing before, it will come back and it will be as if the ulcer was not cured. It was actually cured, just that the same thing that caused it was brought again.
It's all right, doctor. So let's go to the street right now and find out how the overview of people about ulcer, how what people think about ulcer, the ones that are having ulcer, how do they react to this ulcer? So we'll go back shortly.
Okay, I think from what we learnt and what we know, it's ulcer is like a wound in either in your intestine or in your stomach, like a kind of it's a kind of disorder, a wound that you get from probably either an infection or some kind of unhealthy habits like not eating well, not resting well, probably stress. Yeah. Well, it's actually ulcer can be very serious. Some people actually go through serious pains with it. Like some people, you see them when they are having this ulcer pains, they can't eat, they are restless. Some people have to get bed rest. They have to go to the hospital, so it's not an easy stuff. Okay, my advice to people with ulcer is I think you have to take your health seriously. You should eat what you're supposed to eat. Try to get enough rest. Make sure that you are consistent with your drugs and just be self-aware to avoid all these ulcer attacks from time to time. Well, I think the government can help by probably getting more NGOs to create more awareness on this disease and also probably provide more drugs and the rest, help sponsor for those who might not be able to afford the treatment, like cover for their costs. Yeah.
Ulcer is a sickness that is more popular in Nigeria because it's something that we Nigeria feel probably it might be caused by maybe what we eat or what we take intake of what we do. But normally ulcer is a sickness that which we don't actually have. For me, I don't think it has a cure. It's for you to reduce some things what you eat. like pepper, probably gaseous drink, probably alcohol. It has gas in it. Probably ulcer comes with a heartburn and then chest pain. Probably your chest, you will be feeling pains there. And from my own point of view, sometimes back pain too. When once it's chronic, once it's rigid, you can feel back pain too and all that. So from my own point of view, I feel probably if government can come to our aid and look for drugs that can help to cure it, to really help us. Probably some of them goes to pharmacy to complain. They give them all sorts of drugs that probably it will relieve them. Because me, I believe, for me, ulcer is something inside. Worms that eat, feed on your flesh and the rest. It causes wound and it generates to what's it called. So me, I feel probably if government can look into it and provide drugs for it, it will help a lot in the society.
I can't really define what ulcer means, but I know from experience someone that has suffered from ulcer. In fact, ulcer killed my dad. Yeah, so I can tell you the little I know. I know that it's stomach ulcer or peptic ulcer. That's what it was called. And the little I know, it's really terrible, and one has to look after themselves and avoid like certain foods. Yeah, when it start, when the pains will start, he'll have stomach pain. That after a while he'll get better. He'll take his medication, and but to be honest, my dad really wasn't looking after himself. I know that also when it happened, when he died, I went to research on some things. It's just medication, and it gets to a certain level where you now have to really do endoscopy. I don't know if it's common in Nigeria, where they pass a camera through one's stomach and see what's going on. And then if it's really that bad, they have to do a surgery and stitch up the area, the part of the intestine where the ulcer has really affected. And so that's what killed my dad. It was called on the what was it called on the autopsy reports? It was called ensanguination, which really means that the intestine cut. I really would advise them to look after themselves. The medications are really expensive, I know, but you just have to look after yourself. If you want to live long, you avoid the food, some certain foods that the doctor will advise you to. Like I know my dad, he won't really eat that much. I know you have to avoid smoking, you have to avoid drinking. There are just certain food. Just consult your doctor. The doctor will be in a best position to tell you what to avoid. I think there should be more awareness because people they are not really, aware. Yes, government to create more awareness about ulcer. There are certain diseases we pay attention to in this country, like HIV and AIDS. But people can live long with HIV and AIDS just with the right medication. So there should be more awareness on these other diseases or illnesses that people don't really seem to talk more about. It kills a lot of people.
Welcome to Asset Television, your best station for news, politics, business, sports and entertainment. Your one-stop channel, Asset Television.
Okay, we've heard what people are saying about ulcer. So I want to find out from Doctor, do ulcer leads to cancer?
Yes, so as earlier mentioned, ulcer could lead to cancer, but it's not as common as as people think. The average the number of people, in fact, the ulcer could lead to gastric cancer. It could, but there are several other causes of gastric cancer, and many of those other causes are more common causes of the cancer than ulcer itself. So ulcer could cause, but that will be over a long period of years. That will be over a long time, and then the ulcer was not treated properly. It kept causing irritation, and then it happened.
This is going to be a long time. I mean, the person will not be going through pain all the days of
Oh
their
yes,
life,
almost like
just
he was not
that.
treating it well. Exactly.
Oh wow. What are the symptoms of this ulcer?
Okay, so the symptoms of ulcer range from so many things. It could range from pain, heartburn, like I spoke about. It could range from back pain. So usually it's called a peppery sensation in the chest. One will have like a peppery sensation, um, then that would radiate or that would spread to the back.
Sorry, that peptic sensation, is it curable? As in,
Yes,
when you are feeling it, you
yes.
have
In
to.
fact, it's a way to judge the efficacy of treatment. So if the treatment is going well, the sensation should stop, or the sensation, the peppery pain should also stop. Some people, their ulcer could even present with vomiting blood, what we call hematemesis. Some people it could present with them defecating blood.
Wow.
Yes, well, what we call hematochezia or yes, or melina. So it could also uh, it could even, some people even come down with diarrhea, and the reason is that that place is already irritated. The lining of the stomach is bigger, so any food that is eaten, the body just passes it out because it doesn't want it. Like if that place there is, or it's painful.
It's
to,
painful.
Yeah, so any food that
flesh.
comes, just quickly pass it out, and then the person presents with diarrhea.
So how true is it saying that almost every Nigerian is sick of ulcer?
No,
How true is that
no.
statement?
Okay, no. Well, so well, it's not true. The maybe I should have also said it that the way causes of ulcer majorly, just to make it simple for the people watching, ulcer is due to an imbalance between the acid that we produce. So normally the body produces acid, and this acid is to kill and destroy bacteria that is present in food, and it also helps in some form of digestion. So this acid is good in the sense that it helps in killing bacteria. There's bacteria everywhere, but then it helps in killing and destroying bacteria in the food. But it also helps in digesting. It helps in digesting, but it also helps in digestion. Also, I mentioned that. But the acid has the propensity to even burn the body. The normal way, if one pours acid on his body or on any surface, it begins to heat up. So the body has a way of balancing in such a way that acid is produced, but then there are protective factors that protect it. So when the acid overwhelms the protective factor, that is when the person comes out with ulcer. But there's also another organism which has also been implicated, and it's called H. pylori, Helicobacter pylori. Helicobacter pylori is an organism that is found almost anywhere. Almost anywhere.
In the body, right?
Yes, it's yes, and many people with ulcer have Helicobacter pylori. And this Helicobacter pylori makes the protective factor, the protective system in the body weaker. That's just the best way I'll just explain it for.
It's just like, could we say it's just like the immune system?
Yeah, it's a bacteria that reduces the things that the body produces to help us be resilient against ulcer. So in people with it, so many people have this Helicobacter pylori, and that could actually that is an indicating factor. That's why when we are treating ulcer, we also give antibiotic. That's the major reason why. So not everybody has ulcers. Many people mistakenly, for example, chest pain could be it could be heart attack. Chest pain could be many other things. Chest pain could be pneumonia. Chest pain could be could even be musculoskeletal. If one has maybe some infection that are not even ulcer itself, a person who has osteochondritis, that will present like also. There are so many things, and that's why when a patient comes and says, "Oh, I'm having chest pain, I'm having stomach pain," it's like ulcer. It may be any other thing. So many people, once they have this pain, they just go back and take those antacids. They go back and take those drugs
Without diagnosing
without
it.
diagnosing it. And that's why I also mentioned, especially for our viewers, the gold standard for diagnosing ulcer is actually endoscopy, upper GI, and that's why medically we just say probable or query probable ulcer or ulcer-like symptoms until a person does endoscopy. And endoscopy is when there's a machine, is when you have a machine that is put down the person's throat, and then we see for ourselves, and then we are sure that this is actually ulcer before we can say, okay, this person really has the ulcer.
Okay, not until that is done. You cannot exactly say this is.
No, we don't 100% say, we just say suspected. For many of them, it may actually be.
But that could be expensive, and how many
Yes,
people could
yes,
afford that?
but the reason is because there are so many times that people have said they have ulcer. For years, they kept on treating ulcer, and they had something else. Like I just spoke about, people with what we call angina, chest tightness. They will come down and say, "Oh, it's like it's ulcer. I've treated ulcer," and they were treating ulcer at the beginning. So
But they actually went for diagnosis now, and
No.
probably the doctor told them it's ulcer.
most likely we just assume, because actually ulcer is very common. But it's not that most people with the most people with chest pain, chest tightness, or heartburn, it may be any other thing. So many other
But
things.
doctor, if you listen to one of the street viewer, I think she said that ulcer is not curable because she has ulcer. And she has been treating this ulcer for a very long time, and it seems not going. So probably she are just giving up and saying
No,
ulcer is not curable.
no. So that's not like I said. Um, it's best to get treatment in the hospital. So many people just come. I'm a regular medical medical outreach volunteer, and many people come, we see them at the community level, and then we ask them, okay, what have you been using? And they just mention, I'm like, this alone cannot treat your ulcer, or this alone is not enough to treat your ulcer. There's something we call triple base. It's like you're attacking it from three angles, and then it's a comprehensive treatment. It's just like if you don't treat malaria well, it will be as if this malaria is not curable. But if you use the correct medication at the
Medication.
correct time, yes, so that's
Okay.
why. And then you also avoid the things you are supposed to avoid while it heals, because the major thing we are trying to do in ulcer is give the body time to heal. Those medications they also treat, but then the body also needs time to heal for the wound that has already been created there. So if you don't give it time to heal, you are still fasting, it's not eating, or you are eating food that would precipitate or cause more of the ulcer. The person would, it will still be like it's like you are pouring water and then you are starting a fire again.
It's all right. So we are rounding up this program now. I want us to know the treatment for this ulcer. Is it just a normal medication, or there are particular treatments? There are particular ways of treating this ulcer, other than every other disease.
Okay, so we basically divide into two. We have the medical and then the non-medical. That's just breaking it down for everybody. Or we have the pharmacological and then the non-pharmacological. So for the non-pharmacological, which I will dwell on for the sake of our viewers, we have the lifestyle adjustment. Number one, try not to eat food that precipitates. So for some people it is oily food, some people it is beans, some people it is peppery food, some people it is different food for different people. And then also I should have mentioned something very important which many people yes forget about, is that pain relievers, the normal pain relievers that we take, like the diclofenac, ibuprofen that people take, they are very, well, Panadol is not part of it, it's the only exception in the group. But many other pain relievers, they are very strong causes of ulcer. They are very strong causes of ulcer. So if you are taking those drugs, because they have a way of
But why do you think they should take it when they've not been prescribed by the doctor?
which one of them?
The ones you just mentioned.
No, no. So many people just take them on their own. Many people just have back pain,
So
they just have headache. Yes, exactly. So, and you should not take it without a doctor's prescription, without a doctor knowing. And so many times they are available in pharmacy. So many times people just go to pharmacy and just pick it up
wrong
and get
medication.
yes, and there are causes of it. So they avoid those drugs, and also try to, for people who have this reflux, this regurgitation thing, you should also sleep with two pillows. You should sleep with a high pillow. Don't sleep lie flat. Don't go to bed immediately after sleeping. It's
Maybe
also a
there's a
cause of ulcer.
condition for all things.
Yes,
Wow.
exactly. So a person should not just go to bed. But there are so many people. So once you go to bed, especially if you are the type that you eat late, you go to bed and then you lie down and it's like food is coming back already, and you wake up in the morning and you're
I do that all the time.
exactly. So it should not.
Wow.
So the
It's serious.
so it should be that so it's best to eat 3 hours before going to bed, or once you eat 3 hours more, or 2 hours at least.
So with the condition of the economy right now, people do go to work close very late.
Late, yes.
Come back, start making your food. Without food, you can't actually sleep well. So you just have to prepare your food and eat. But by the time you are eating, it's probably around 9 p.m., 10 p.m., some to 11. So that's a bad habit.
Yeah, I think planning is another thing. Planning will also help too. If you plan, and for places with good electricity, you can cook for a long time in such a way that when you come back late, you can quickly warm your food. You can cook for like a week, 2 weeks. I think that's also another, because health does not know economy.
That's true.
So
Very-
one has to
very
eat
correct,
healthy
yeah.
and live healthy. So also we have talked about the drugs to avoid, and foods also to avoid. Then for the medications, we have the triple base therapy for ulcer. We have ulcer kits that I believe and should be taken for the comprehensive period of time, problem with ulcer is once you begin taking the medications, within 24 hours, you will feel better. Um,
You feel better,
you
but
feel
later it will
yeah, so you
surface.
feel better. So many people stop at that point, and that's not correct. You are supposed to take it for the full period of time. Yes, for the complete period of time, either for a week, 2 weeks. You're supposed to take it comprehensively until that won't heal. In fact, sometimes up to 3 weeks that you have to take the medication for so that it can heal properly. And I also want to tell you that sometimes ulcer could get so bad that people have to have surgery for it. So there are surgeries that people do as basic as ulcer, or we are looking at it. There are surgeries that people do for ulcer. I don't want to go too much into that, but it's usually for very advanced stage ulcer that have tried medical treatment that are not going for it. So basically, those are things. So lifestyle adjustment. So if you don't adjust lifestyle, you're just taking medications, it will still come back. There are precipitants of it too.
Okay, for those suffering from ulcer, you've had it, it's curable. It's not as bad as you think. So try as much as possible as you can to take good care of your health. So finally, on the final note, Doctor, what do you have to tell those that are suffering from ulcer, or is there no way we can actually probably um talk to the government about it, probably to provide more health care or kits for these ulcer patients?
Okay, so I usually like to approach diseases from the preventive approach, and I believe that that's what will help us in saving a lot of money. Like I said at the beginning of the show, that ulcer could affect our lifestyle. It could affect our daily routine. Yeah, our quality of life, the quality of life that we have. So prevention. So many times we pick up this Helicobacter pylori I spoke about. We pick it up from food that are not well cooked, that are not well, from from the environment,
Veg,
dirty, yes, well prepared. So if there are laws, if there are ways in which there is better sanitation, cleanliness in the environment, even in the food that is being made, it would save us a lot. And then that's why, and also there should be better health education for people. Many times we've seen patients that were chronically on all these diclofenac, ibuprofen, and they come to the hospital, and by the time we take history, they by the time we take history, we see that these drugs were things that they should have known, they should have stopped taking on, and they stopped taking without prescription. So many times, so health awareness, many NGOs, many schools, many people should advocate so that people are more aware about these things.
It's okay, you've had it all from Doctor. We'll end the program at this stage. We hope to see you next week, same time, same station. Stay tuned. I am Blessing Chima, the regular host. And with me, Dr. David Babalola, we're saying bye bye and take good care of yourself.